mayor of Khuzaa, and this is part of the municipality and part of the primary healthcare center. So I will give Dr. Fuad to brief us a little bit about this and to greet us, and then we can move to the others.
Really, this is one of the parts which destroyed. But here we find the Khuzaa.
Welcome everyone, and thanks for coming. I know the weather is a lot hotter than we expected, so thanks for your patience. My name is Maha. I'm with the Palestinian Medical Relief Society, and here is one of our mobile clinics, which we've been working here for almost a year and a half. We had mobilized a number of mobile clinics during the emergency. Most of those were temporary projects that ended by January 31st. This was our best decision to localize one of the mobile clinics in this area, because as you can see, the need is very high. We're in an area called Khuzaa. The population is about 14,000. We receive between 100 and 140 patients every day. The need is very high. We hear a lot of people asking for more locations, for more visits. What we do here is provide general doctor. We have a lab, small lab with a lab technician. We provide medications, and a nurse is also available. All services are provided for free, including the medications. There is another center here for the Ministry of Health, which is operative right now, but the Ministry of Health, as you know, suffers a lot of shortage of medications. Right now, we come to this location once every 2 weeks. We visit Khuzaa though once a week. We have another location in Khuzaa where the other caravans are located.
Wards, we have 12 beds, 9 beds in the big hall. Actually, we try our best to deliver good work for our children, and we receive cases from different hospitals. We receive surgical cases from Nasser Hospital, and we receive many other different cases from Al-Emirati Hospital and other. I'm going to talk about the situation here. It's difficult for us to work because we have lack of everything. We have lack of medication, we have lack of equipment, and we receive many cases that it's too difficult to be dealt with in these situations that we have.
And the river vein requested almost. So this is just for example, this is one patient who was diagnosed 3 months ago with kidney cancer. We have for this disease about 5 or 6 drugs. None of them is available.
Among us today we have colleagues from Norway, from Sweden, from Switzerland, from Korea, from the European Union. My colleagues from the UN agencies, I've already mentioned WHO, also UNFPA and UNICEF. We're here today to underscore the right of health as a national and international responsibility, but in a very specific, I would say, unique setting. Today's event is focused on access to adequate health care, a core concern in Gaza. And to this end, I think today's field visit has aimed at improving everyone's, including my, understanding of the formidable problems and challenges facing the health sector in Gaza by allowing us to engage with health workers and indeed with patients. And a special thanks to the patients that we imposed upon in today's visit. But those visits were important for us to better understand not only the structural health problems facing the people of Gaza, but how these problems are compounded on a daily basis due to the blockade and due to the intermittent violent conflict, including the war that affected Gaza for 50 days this past summer. So the basic right to health in Gaza means, in simple terms, that men, women, children should have access to quality health services in clinics and in their neighborhoods and in hospitals and urban centers. But today, we see that thousands of patients must travel far to reach a primary health care clinic because theirs was destroyed or severely damaged, limiting access to health care for many. And additionally, families whose homes were destroyed and live in unhealthy conditions in temporary housing are exposed to health visits. And I think we saw that on the margin of our first visit this morning, some people that are living in really difficult temporary housing conditions. Although construction material is entering Gaza, and indeed some 75,000 people have purchased construction material to date, reconstruction and rehabilitation of health centers continues to be hampered by limited funding. There is some good news in the fact that some 11 large-scale infrastructure reconstruction projects are currently being implemented, and here I'd like to thank the Qatari government for funding the work at the Sheikh Hamad Hospital for rehabilitation and prosthetic limbs. But clearly, today's visit underscored that so much more has to be done in terms of just rehabilitating the basic infrastructure. Let us all remember that during and after last year's Gaza conflict, the health sector in Gaza performed with exceptional dedication and perseverance. Emergency workers rescued an unbelievably high number of injured people and brought them to clinics and hospitals. And I myself witnessed how they worked under exceptionally difficult circumstances with great dignity. I think that will always be something that I'll treasure in my time here in Palestine. Indeed, over 9,000 health personnel treated wounds with knowledge and expertise, and in many cases with enormous ingenuity, making the best of a very difficult circumstance given the lack of medical supplies. And many went to work in spite of the availability, in spite of the lack of availability of salaries for months. I'd also like to pay tribute to those health workers that were killed during the conflict. A couple dozen health workers, I understand, were killed in the line of duty or simply trying to get to work to perform their functions. So the events of last summer will never be forgotten. The reminders are the injuries of the people that we suffered. Some 10,000 people were injured during the conflict. We estimate about 1,000 of them will be permanently damaged. The damage on the ground that we've once again seen today, the debris in the streets, as well as the affected facilities, the destroyed homes, schools, factories, etc. So what are some of the challenges that need to be overcome? And with this, I'll finish my remarks. And here I do want to pay tribute to the international community. The international community once again has provided assistance to the health sectors, and for all of you here today, allow me to thank you and the populations that you're serving. But I also have to be frank, and I think the visit underscored that today. We have a tremendous shortage of the most basic medical supplies. It's estimated that some $14 million is needed to ensure the purchase of an adequate supply of drugs for the next 6 months. We've witnessed a lack of medical equipment and supplies. We've seen equipment that literally is being held together with bandages and what looks like Elmer's glue in the neonatal clinic that we visited about an hour ago. Another problem that I hope that was made apparent today is the unreliable power supply to run the equipment in hospitals. Imagine running a neonatal center when you're subjected to 12 to 18 hours of power shortages and your backup supply system may not be working well enough. And also the uncertain referral system for patients who need treatments to the West Bank or elsewhere. And here, I would like to call again upon the Egyptian government to open Rafah for the travel of patients to and from medical destinations, as well as to open Rafah once again for the incoming relief medical supplies. This is a call that we've made to the Egyptian government on a number of occasions, and we're again appealing to the Egyptian government to allow medical referrals and allow medical equipment and supplies to come into Gaza. In closing, Thank you again, WHO, the Ministry of Health, for arranging for this trip. Thank you to the international community for providing the support that you've provided so far. And let me just appeal on behalf of all of us here today for continued cooperation. The people of Gaza deserve no less.
I start to understand better the situation and the hardship. What is also clear is that health is not only about clinics and hospitals. It's clear that, you know, when we go or particularly consider the situation in these makeshift houses today, that, you know, it's the social determinants of health that play an important and critical role. Indeed, you know, the housing situation, the water situation, to some extent the food situation, the high unemployment rates, the poverty that are, you know, greatly influencing health. And however excellent we might, you know, be able to organize our health services, we will have limited impact if we don't resolve these broad underlying issues. Some of the chronic underlying issues is really the chronic underinvestment that the health sector has seen in Gaza. No doubt that the destruction during the summer war was enormous, that, you know, many health clinics were destroyed, were having damage, we're seeing damage. The Wafa hospital was destroyed completely. No doubt that reconstruction is going too slow, far too slow, despite enormous efforts from the international community to mobilize resources. But I think the bigger problem on the health side is really the chronic underinvestment that the health system has seen over the past decades. And that's reflected in a variety of facts that we are seeing on the ground. On equipment that is partly completely outdated, on building situations where you really don't want to have the experience to be a patient under such circumstances. Being a patient is not nice altogether, but, you know, it's even worse under such dire circumstances. The chronic drug shortages was already mentioned. 30% of average during the last 5 years of having drugs of the essential drug supply list. It's zero stock, and some of the examples that some of the critical medications for oncology patients, for hepatitis patients are not available at all, or in rather limited supplies that you need to prioritize, which puts physicians often in a very tricky and difficult situation to take such situations on life and death. We still, you know, are confronted with the fact that many of the doctors around that are working very hard are not receiving regular salaries, their salaries on a regular basis. I think we need to enhance our effort to ensure that, you know, those people working very hard, and it's not only affecting the health sector, it's affecting all the sectors, all the public sectors, that they are receiving their salary for the hard work that they are doing.
We have seen in the last report of the Ministry of Health that about $500 million shekels were invested in the referral abroad for all the OPT. About 1/4 of them maybe for Gaza. But that also, if we look at the numbers, we look at 2006 or 7, or even in 2000, we have referred from the OPT 8,000 people, now 74,000 people. In Gaza, in 2006, we are referred, the health system referred 8,000 people, now 17,000 people. Although the investment, although the procurement of new machines and so on, we have more MRIs, and apparently it should have been going down, but it didn't go down. It went up dramatically. The challenges are enormous and the needs are big in the health sector, but we are looking at this kind of events to advocate for the not only the priority areas. We know the areas that are needed to be invested in. There are services not available. There is no, for example, radiotherapy, and many people are going outside Gaza just to have the few minutes of the session of the radiotherapy. But once it is available, that can give services to many people. Dr. Ahmed showed us in the oncology department how much the drug affects the availability. One drug out of 3 in the protocol can hamper the treatment of a person for a life and can be life-threatening.